this event. It's been a lot of fun. We've been putting these on for a year now and had a lot of success, raised a couple $1 million off of it, made a lot of great contacts and built a lot of confidence for the companies that are pitching. My group is called Dental Venture Capital. I'm an advisor for startup companies helping bring products to market. I've helped launch hundreds of products, worked with almost 1,000 startup companies now over the last 25 years being in the dental industry. We take companies from idea to exit. Several of the people that are on the call are early in their process. They're at the idea phase, and then others are all the way down to the scaling side of it. And we implement processes, tools. I call it the innovator's operating system. I like to continuously challenge the startup companies to get their message very succinct. So real quick, a successful pitch, quick intro, problem statement, solution, talk about traction, and make sure you're call to action. What's next? And what are you looking for? Money-wise, customers, partnerships, across the board.
My name is Evan Schlossberg, and I am the CEO and co-founder of The Gleamery, and we are reinventing dental care for millennials and Gen Z. The Gleamery is a dental care studio that offers specialized services rooted in health and wellness and beauty, designed for the modern consumer. And our goal is to build a national brand of next-gen tech-enabled dental studios that offer convenient, enjoyable, and effective dental care for modern consumers. It's a large $170 billion market, recession-resistant, structurally very profitable, highly fragmented with long, sticky, valuable customer and patient relationships. Millennials and Gen Z, who make up a full 40% of the US population, the largest cohort in America. All that to say, ironically, dental remains the last untapped pillar of the wellness economy, and there's never been a better moment in time to serve the dental needs of this millennial and Gen Z cohort. As you guys all know, our smiles have never been more front and center, specifically with the Instagram and the TikTok generation, who is obsessed with the perfect smile. It turns out that wellness and beauty are actually two of the highest spend categories for millennials and Gen Z, and dental sits right at the intersection of both of those two really important areas of spend. Oral health has really entered the wellness conversation, and I think the radar very much has hit for the oral health, full body health connectivity. And then the broader consumer service space is really getting disrupted, and you see a lot of legacy industries, whether it's veterinary, med spa, hair salons, OBGYN, and fertility. That's where the Gleamery really comes in to do that and reinvent dental care for the modern consumer. And in just 9 months, we've achieved best-in-class four-wall dental metrics. And how do we do it? So it starts with our service offering. We have easy one-click online booking. Our appointments start and end on time. We have transparent pricing on our website with no upsells. And our hours are, we're open 7 days a week, and we have nights and weekends available. Our studio spaces are beautiful, designed like a spa, look like a spa, smell like a spa, sound like a spa. We don't have drills and needles, which obviously everybody hates. We also put tech at the center of everything that we do. Our flagship West Hollywood location, which launched in August of 2024, is on its way to a $5 million annual revenue and 35% four-wall EBITDA. Where are we going? Plan to open 30 locations by 2028 and then 100 locations nationwide in the longer term. That 30 location plan will get us to a $100 million revenue business within the next couple of years. Our team is equipped to execute on this plan. We have success in dental, in consumer brands, and in four-wall businesses. So we're raising a total of $1.6 million, which will be used to open our second location in Santa Monica here in LA. We have closed 650 so far. So there's about $950,000 left in the round. We're raising on a safe note with an $8 million pre-money cap. And so would love to get you involved in this journey.
What we created after I started working in my dental office as a clinician, I saw all these pain points that come across dental business owners about keeping the productivity high and efficiency high. And along with doing all the clinical work, we thought of creating an all-in-one AI-powered technology. And the problem that we are solving with Dentrax, that pain point we solved by creating a technology that can do a lot of work on its own due to automation and AI that is involved in our platforms. How do we do that? Like I said, we created an ecosystem where everything from the point of the first phone call coming to the office all the way to the balance of the patient becoming zero. These are all the modules. So this is a little description of all of them. I'm going to just slow through them. So we do have a superior product in comparison to the market. There are lots of competitors in the market in the check space. But if you look at what we provide compared to the others, we are providing a whole ecosystem. And then what are the things we actually deliver? The deliverables that we have seen over the years with our clients is increase in their productivity, but it's a great market. We all know that dental market is almost like a $2.2 billion industry on the technology side. We are only targeting, say, for example, 522 million. So our target is to achieve a client base of about 10,000 customers by 2029. So if 4 million is raised, which is our ask, we are valuing the company at 26 million at this present time. After we reach our targets, we will be returning a value of 850% as the revenue return of investment for the customer, for the investor. How are we going to spend our money? Most of it is going to be spent on sales and marketing effort. And our growth milestones have been achieved so far. So right now we are in the phase of acquiring customers. So overall, this is our team so far, and we are looking for advisors. We are looking for people who can partner with us.
I'm Dr. Mark Thorson, retired general dentist, dental educator, dental innovator, and dental sales professional. Dental patients generally want three things. Please do a really good job. Please do it very efficiently. And please don't hurt me. Inflatrix is a simpler, faster, and more comfortable matrix for Class 2 restorations. The current systems work, as I said, but they take a long time. The average clinicians require between 60 and 75 seconds to place all of the hardware. This is a very generic photograph. The current procedures, though time-honored and successful, usually cause some discomfort, most often postoperatively for the patient. What's the solution? Thanks for asking. The solution is Inflatrix. It is one piece. It's an inflated device that holds itself in place with air and water pressure. It's much more efficient. It goes into place in less than 30 seconds and much more comfortable. I'll be happy to answer questions about components and how it's built and what it's made of in the Q&A. I'm starting at my demo video here. This is me narrating, but I'll move through our market here. Annually in the US alone, 83 million Class 2 restorations are placed. Our specific addressable market is doctors that are GPs and kids dentists under the age of 45. Our marketing approaches, Travis knows this beautifully. He's helping to line most of it up. Our gross profit margin at capacity is 95% or so. Some basic quotes here. Our achievements at the end of 24, I was named one of the winners of our Regional Energy Capital Startup Challenge. I'm very proud to boast about having a piece of $50,000. And now we're continuing our beta testing. I do have a window that's closing fairly soon on beta testers. If you're a clinician and you'd like to be a beta tester, use the links that Travis has put up in the chat. There's 3 ways to collaborate with Inflatrix. You can become an investor. We have things lined up. All these QR codes lead directly to the correct pages. My ask, which is we're looking at a pre-seed round of 650,000. So thank you very much for all your attention.
My name is Mark Aniello. I'm the CEO and co-founder of Ethics. We're talking about both the procedures and the workflows. What are the goals? We want to always try to increase efficiencies, improve data visibility so we can drive effective decision-making. And the ultimate goal is really to identify, and when we're talking about practices, we're looking really at the clinical side of the practice. Now, certainly one of the things when we start talking about specific problems, I look at it, poor worker engagement is at the top of the list. And we can see all the different problems there and what they can cause as far as a potential issue. So again, what are currently practices doing? What do we do? Ethics is a business intelligence software that really focuses on the clinical side. For a busy dental practice, Ethics is a comprehensive solution that automates tasks, reduces paperwork, and frees up staff time to focus on patients. What do we have here? Simplify compliance in a single, comprehensive, cloud-based platform. This is our dashboard. We have an excellent suite of intuitive compliance management tools. Big picture, everybody's talked about it. When we're looking at dental practice management software, around $4.5 billion this current year, a good growth at 11 to 12% annually, looking to be around 7.5 billion. We believe that we provide a dental focused solution. When we take a look at our revenue channels, they're diverse. One of the things that we believe is building strategic partners, mutual enhancement of offerings, scaled revenue, shared resources. Good traction, right? We have over 100 clients currently on the system with over 330 locations and over 4,000 users. What are we looking to do? We're looking for unique strategic partners that can enhance both of our offerings. We're looking for capital to allocate toward asset acquisition, expanding the team, operational capabilities, and driving marketing efforts in our great team.
My name is Amnutai, and I'm the founder and CEO of Elite Dental Force. And we are a SaaS startup company located up in Saratoga Springs, Utah. And we are on a mission. And our mission is to bridge the communication gap between dental office staff members, insurance companies, and patients. We do that by providing a software called Edify. Edify is the first AI solution that helps dental offices understand the rules of insurance companies and matching it with the rules of CDT codes and et cetera. I want to jump right into the pain point of what we're facing in the industry. The three biggest pain point that is happening in the industry is staff turnover rate, insurance reimbursements, and overhead costs. The dental billing system is broken, staff burnout is real, denials are brutal, and overhead costs is killing growth. We're not just fixing billing, we're redefining how money moves in the dental practice. Our ultimate goal is to actually have clean claims, but in order for us to do that, we have to actually start from the beginning to the end. There's a total of dental offices in the US, and 80 to 85% of them go through insurance companies. That's about 50 to 60% of the revenue. Administrative costs is about 15 to 25% of the revenue. Loss due to errors, about 15%. And then 25 to 30% is from your cosmetics and out of network. And so I really wanted to actually go in and dive into the 3 years so we can actually understand. So these guys are, most of you guys are well known. You guys are familiar with these guys. Our solution is Edify. Edify is the end-to-end AI powered solution for dental billing and insurance. What makes us different? What makes us different is our edge comes from our deep vertical integration and unmatched access. This is our core team. These are some of the partners that we've established. Our business model is a SaaS. It's a subscription. This is our market size, our TAM, SAM, and SOM. We're looking for introductions to investors to help us close our 2.5 million seed round. And that's Elite Dental Force. Thank you for the time.
My name is Sam Rockwood. I'm founder, CEO of Woods. Our mission is to modernize the way dental offices get paid from their insurance. This is just a snapshot, a lot of numbers here, but CAQH puts out a study every year identifying how providers and insurance companies communicate with each other and what percentage of those are electronic. There's a lot of checks flowing around from insurance to dental offices. So this is where Woods comes in, helping your office have paperless insurance payments. And once everything is paperless, then you can start automating the reconciliation. What we do is we have a 30-minute onboarding session to start. Additionally, rather than getting EOBs in the mail, we have a dashboard where all of the EOBs are in one place. They're all electronic and it's very easy to use. We have a very diverse advisory board from the dental industry, from an insurance side, and as well as from the tech. And the status is that we spent most of 2024 in development. We had about a dozen beta testers in the early part of this year, interest in growing it. And that is part of why I'm chatting with you today, is because we need capital to grow the team and help us scale as we're growing these partnerships and going to continue to rev up the sales engine. So that is my ask. And I would love to chat. If you want to learn more about it, then reach out to me. I'm sam@woods.dental. Thanks.